Bismillahirrahmanirrahim. Today's class is about the topic from the infectious disease. We are discussing with the infectious disease module. Sorry, and the topic today we are discussing is the anti-malarial drugs. Okay, so far you have been discussed with the other topics. Today we will discuss the anti-malarial drugs. Okay, before any further delay, we come to the first slide. Okay, this is basically just a revision of this malarial life cycle. Uh, Although you people would have discussed these thing in your physiology or other part, but we are just going to review this so that because this is important when you're going to discuss with the different mechanism of the anti-malarial drug. So this is sort of summary that you know that malaria is basically a disease which is spread through a parasite, and this parasite is basically transmitted from the a female anopheles mosquito. So first, when the mosquito bites to any person, the infected mosquito, the female mosquito, the first form that goes into the blood of that patient is basically the sporozoites. So sporozoite forms goes into the blood, and the thing that has to remember is that these sporozoites can directly enter into the red blood cells because the primary site for these malarial parasite is red blood cells, and they can also incubate into the liver. So this is known as exoerythrocytic phase. This is important because in the liver these spores, so they remain for a long time, and that is the reason of recurrence of malaria. People really come into the clinics that they have frequent episodes of the malaria, although they have taken all the medicines, but even then they complain that every month or after 2 or 3 months they have the same symptoms of the malaria. And this happens when this sporozoites or these remain into the liver. So there are certain drugs that we will discuss that eradicate this infection from the liver. So life cycle is important from also to understand the different mechanism of the antimalarial drugs. So first from sporozoites, they enter mainly into the liver where they incubate, and they can also goes directly to the blood. In the liver, then and the main form that basically causes the recurrence is Plasmodium vivax. This is I'm showing through this arrow or mouse. That Plasmodium vivax and Plasmodium ovale, they are the two malarial forms that basically causes the recurrence phenomena. So we have to focus on to the drugs that basically kills this vivax and ovale form because they causes the recurrence of this malaria, which basically they live into the hepatocytes. Okay, so sporozoites comes into the blood, goes to the liver where they stay, and then they basically move to the red blood cell. In the red blood cells, they are known as merozoites, and these merozoites then multiply into the red blood cell. This is known as erythrocytic cycle or erythrocytic phase. This phase is the phase which is known as the when the clinical outcome of the disease comes. When these spores or the malarial parasite is present in the liver, there is no symptoms, but the symptoms arises when this parasite moves or multiply into the red blood cells. Okay, so erythrocytic phase is the clinical phase in which there is a multiplication of the parasite. Then these merozoites they further move on and they form gametocytes, and this gametocyte then is taken up again by the this mosquito, and then there is a other cycle. So two phases are important when we discuss the drugs in human. First is the main phase where the clinical outcome of fever, chills comes when it is in the erythrocytic cycle, where it is forming the merozoites, also known as schizons. So because we discuss is known as schizonticide. So one form of this parasite is also known as schizons, merozoites, and then the schizons form. This is in the red blood cells. So primary focus is to kill the parasite in the red blood cells so that the clinical symptoms will subside or the patient will recover. And the second important phase in the malaria is that you have to eradicate the infection from the liver, because if it remains into the liver, it will cause a recurrence phenomenon, and this is something cause burden to the patient, and he always complain that we have taken I have taken the all the medicines, completed the course, even though again I am having the recurrence phenomena. So you have to kill the parasite into the blood phase or in the red blood cells. And second thing is that you have to also eradicate this parasite from the liver. Okay, so this cycle, just for the repetition, so that you can understand what are the different phases of this malaria that happens when it moves into the human body. This is again the same diagram which I have been represented. It is represented with the number of steps. First is fact is the same, that mosquito inject or infect the patient, and the sporozoites come, and then they basically migrate to the liver where they form merozoites. These merozoites then again multiply. And so here this is important, that drugs that basically affect on red blood cells, they are known as erythrocytic. The drugs effective against erythrocytic form, and these drugs we will discuss one by one with their mechanism and all these properties. Artemisinin, new drugs come in market. Previously very well known chloroquine, quinine, mefloquine. This quinine group is very well known, and it was previously used. This is a new introduction, artemisinin, a Chinese drug that is very common into the nowadays. So they are drugs that affects on to erythrocytic phase, and then when this moves on, and one there are drugs that basically affect onto the liver. So this is the same representation of the diagram that I've already discussed, different phases. Now we'll come to our main part. Okay, this is also given that there are some drugs that affects on gametocyte form or ether or exo. This is the liver. Primaquine, remember always the drug Primaquine. This is a very good drug. This is used for basically eradication of the parasite. So okay, we will come one by one with the different the details of these drugs. Okay, so we can classify anti-malarial. So there from we start with the main pharmacology. We classify whenever you are asked for to about anti-malarial drugs, you classify according to this classification, like they are blood schizonticides. Schizonts, I again told you, is a form of parasite. When it multiplies into the red blood cell, it is known as schizonts. So schizonticide basically, this is the erythrocytic phase. So they act on erythrocytic stage, which is the main clinical illness phase. And the drugs that is used for blood schizonticide, you remember the chloroquine group or the quinine group, chloroquine, quinine, mefloquine, they are the same group or belong to the same chemical structures. Halofantrine is a good induction. Then we have proguanil. This is different. Pyrimethamine, they are the antifolate drugs. Pyrimethamine and sulfadoxine are the antifolate drugs. So basically, when we come across a patient with malarial symptoms like he complains of high-grade fever with chills, and when we suspect that he may have the problem of malaria, then we start usually with this chloroquine group. Until unless we face the resistance or other phenomena, then we switch on. Otherwise, chloroquine is a good choice to start with the anti-malarial therapy. So you remember these anti-malarial drugs with chloroquine groups, halofantrine, proguanil, and the antifolate drugs. Pyrimethamine and sulfadoxine, they are the antifolate groups. Okay, so first we classify blood schizonticide. Okay, then we have tissue schizonticide. When this parasite is present into the liver, again I told you that it incubates into the liver. So the drugs like proguanil or pyrimethamine, they are also effective in when this is present in liver tissue. Gametocide is a process that basically it happens into the uh, uh, it is in the later stage. This is basically used for prevention of this of the transmission, because in the last stage the parasite converted into gametes, and these gametes are actually taken up by the mosquito again. So for prevention from one person to another person, these drugs are basically used as gameticides. So they are not very much of concern because they are required for to stop the transmission process. Primaquine, chloroquine they can use so that there would not be further spread of this disease. Okay, the fourth group. So you remember that chemiticides are important, but they are not of very much importance. Main drug that you have to remember is blood schizontricides, the hypnozoids, because hypnozoids are, I am telling you again and again that you have to eradicate this infection from the body, and this dormant form that remains in the liver, this is caused the recurrence of the infection. So the only drug that is effective is primaquine. So remember, always remember primaquine. This prevents the relapse phenomena of the disease. So relapse of this malaria can be stopped if you give the patient primaquine, so that the dormant form of this hypnozoids they will kill by this drug. So hypnozoitosoids that kills the hypnozoids. And again the spermatocyte, they are also not of very importance. This drugs effective in the mosquito, which is not of primary concern. So the spores killing, gametocide killing, they stop for the prevention, whereas the main drug that we focus is blood schizontricide to stop the clinical symptoms. And even if the clinical symptom has been masked or they have been stopped, we give these hypnozoids so that there will not be relapse of the phenomenon. So this is the main classification of the drug. Now we will come to with the different properties or individual. We will discuss the individual drugs now. Okay, this is again I just gave you a summary. This will be more understandable to you when once we close or we complete the class. Otherwise, you just remember that one of the ways, as I told you, that you can classify according to the different phases of the parasite, and the other way of classification is on the basis of their mechanism of action. You should remember what are the different mechanism of these drugs. For example, the quinoline groups. Quinoline we understand the different forms of the, like chloroquine, quinine, mefloquine, all this group, this comes into the quinoline. So quinoline, whatever is the type of drug, they basically inhibits the heme crystallization process. Okay, we will discuss what is heme crystallization. So just remember that all these quinine group or quinoline groups, they affect on in the red blood cells, they affect on onto the heme and they prevent the heme crystallization. Artemisinin, I just told you, it's a new group, it's a Chinese drug, came into the market, and this is a very effective drug, and this cause it basically affect through free radical generation. So they causes free radical generation, and this is how they kills the bacteria. So the mechanism are different. It affects on heme, it works on free radical generation. Antifolate drugs, you always know that antifolate drugs basically inhibits the DNA synthesis. So we have pyrimethamine and sulfadoxine. They affect through DNA synthesis. Etoboquan, this is it's a similar it's a group that is quite near to this quinine group, but this also affects on mitochondrial membrane potential. Antibacterial, there are very few drugs, or they are not of very much clinical significance. Sometimes they are used, some antibacterial like tetracycline, clindamycin, fluoroquinolone. They might be used in a certain condition, in specialized condition. And these topics are discussed in the antibiotics. So main four groups are quinoline, artemisinin, antifolate, and etoboquan. So they are the four groups. We start with the first drug that is very well known, that is chloroquine. Chloroquine is a drug that belongs to aminoquinolines. You will find out a little um, no, s- uh, slight changes in the name, but aminoquinolines is the chemical parent compound that uh, is used for the chloroquine. Chloroquine is given usually as oral drug. It may be given as IV, but it is usually used as an oral drug, and this is used for the falciparum malaria. You know, this form of malaria is very resistant and dangerous. So, chloroquine is usually effective against this falciparum malaria. It affects on erythrocytic stage. This we have already discussed that there are phases. So, the effect on erythrocytic stage. When we give chloroquine, usually the fever subside within 1 to 2 days, means 24 to 48 hours, and also it kills the parasitemia completely in 2 to 3. So 2 to 3 days it takes to completely mask the clinical effects like fever, chills. They are removed when you use the chloroquine. Important thing to remember about the chloroquine, it has a very long half-life. Okay, the half-life of chloroquine can be in the months. So this drug remains into the body for the months, 1 to 2 months. This drug may remain, but usually it the half-life is shown as 3 to 5 days. But remember, chloroquine has a very long half-life. This drug can also be used for chemoprophylaxis. So prophylaxis can be also seen in this condition. So first drug, chloroquine, used for as oral drugs, effective against all 4 forms of the malaria, but also for the sensitive form. The problem that we are facing nowadays is the resistance form of the falciparum. So this drug is not effective in the resistant form. Otherwise, the usual forms, or if the drug the parasite is not resistant, then this is a very good drug to start with the therapy. Mechanism, okay. The chloroquine mechanism is usually very much asked, and it is also very much discussed. The specific mechanism of the drug is that when the parasite enters into the red blood cells. Okay, we told you that when the parasite when a patient is infected with this parasite, it goes into the blood, where from it goes to liver, then it comes to the red blood. So when it comes to the red blood cells, it basically effect on hemoglobin. And what it does, it breaks the hemoglobin into heme and amino acid. The target of this parasite is to take amino acid for its as an essential nutrient for its growth. So the target of this parasite is to take amino acid from the hemoglobin and then to multiply itself. When it takes amino acid from this hemoglobin, the heme remains, and this heme basically is toxic for this parasite. So heme is toxic for the parasite. So what it does, it basically converts this heme into or it polymerizes the heme into a form known as hemozoin. So the heme which is toxic to the parasite is converted into a non-toxic form, that is hemozoin, and this in this way this parasite remain safe. This step is usually is the target for chloroquine. Chloroquine stop this phase. It does not allow heme to convert into hemozoin. So when heme is not converted into hemozoin, it is in the free form, and this accumulated heme or free form of the heme is toxic both for the parasite as well as for the red blood cells. So this kills this bacteria, and this is how this parasite is killed. So chloroquine acts on heme. It inhibits the conversion of heme into hemozoin, and this free heme is toxic to the this parasite, and this is how it kills this parasite. So this is the specific mechanism. Okay. The problem that I'm telling you, that the problem is with the resistance. The frequent use of this therapy for malaria. This is a very common practice also in our country, that we usually do not diagnose malaria from the clinical test. We just expect the patient that, okay, if a person having high grade fever with the chills, we just declare, okay, he may have or she may have the malaria. So we start giving this anti-malarial therapy. That is one of the reasons that it produces resistance into the community. Also, uh, uh, multi-drug resistance also is present in different drugs as well. So whenever we find out the resistance, so chloroquine is not a good drug for the resistance form of malaria, especially for the falciparum. So when we have resistant form of falciparum malaria, this is not an effective drug. We can use other drugs like verapamil. This is one of the study that these drugs can be helpful to reduce the resistance of this of the chloroquine. But it- so you remember that the resistance of this chloroquine can be reversed if we use these drugs along with the chloroquine. Okay, what happens if you have a resistance form of falciparum, or you see that you are giving chloroquine, but the patient is not responding? What is the form that then you suspect, oh, he may or she may have the resistant form? Then the drug of choice is quinine. So for sensitive falciparum or other forms, you give chloroquine, but if you find out the resistance, then you give the quinine. Quinine is also belong to the same group of the chloroquine family. It's a blood schizontoside. Thing to remember about, it's a natural compound derived from a it's an alkaloid. Alkaloid is a nitrogenous natural compound from the plant. Our term is used alkaloid. Whenever you find out alkaloid, means it's a natural nitrogenous compound from a natural source or the plant. Okay, so it's basically from cinchona tree or whatever you pronounce it. So it is a natural compound. Again, it has the same action, parasite heme polymerase. It inhibits, just we discussed. The good thing is about that it is effective against the resistance form of the Plasmodium falciparum. Usually it is given in the IV form. So in complicated cases of the malaria, we give this chloroquine. What is wrong with the chloroquine? That it has a serious side effect. It may cause synchronism, a phenomenon with GI disturbance, headache, blurred vision. Synchronism is a complete process. Vertigo, tinnitus. It may cause cardiac arrhythmia, abortion, hypoglycemia. But the hallmark of the side effect of this drug is black water fever. This is a fatal condition, which is happens due to hemolytic anemia. So when we give this drug, the reaction of this hemolysis is very quicker, and this hemolysis causes load onto the renal on kidney tissue, and it may results into the renal failure. So the thing that we have to remember that, okay, in resistance cases we can give the quinine, but we have to keep in mind that this drug may cause a serious reaction like black water fever. So this is important from the side effect. Okay, the first we discussed the chloroquine. Then we, in the resistance cases, we have quinine. Then we, third drug, we have the mefloquine. Mefloquine is also a good drug. It can be given as a schizontoside, given orally. Also, this is again for the sensitive form, not for the resistant form. But the thing that remember with this mefloquine, that this is used as a first line prophylactic drug. Okay, you see, malaria is a disease which is very endemic to the areas like in African countries. Whenever you move to a country where this drug is endemic, means it is present into the community, so you take a prophylactic drug. Okay, you take this drug so that you will be safe from the infection of this disease. So this drug, you remember, from prophylactic point of view. Although it is effective as anti-malarial drug, it can be given in the clinical symptoms, but this is usually given for the prophylactic use. Okay, mechanism is same. Again, all quinine groups works on heme synthesis, whatever we have discussed. Okay, the dosing is weekly, so this drug is weekly given, not daily. So whenever you travel or anyone travels into the remote areas or the areas where the malaria is endemic, then we use this Mefloquine. One of the side effect of this neuropsychiatric disturbance, which is not very common because the dosing is very slow. Once weekly, it does not. If you take it for a very long time, then the symptoms can occur. Okay, the fourth drug is Primaquine. Primaquine, I told you, you have to remember this drug. This drug, which is a synthetic 8-aminoquinoline. Again, it's a derivative belong to quinoline group. The main action of the drug is that it is effective against the liver hypnozoids. Okay, I told you that hypnozoids are the form of this parasite that remains into the liver where they causes the recurrence phenomena. So in order to avoid this recurrence phenomena, or for the radical cure, we use the drug, the Primaquine. Two forms of the malaria, Plasmodium ovale and vivax, they are well known for these hypnozoids. They remain into the body and they causes recurrence. So Primaquine is a main drug that is given for radical cure so that patient do not have recurrent malaria. Okay, dose is 30 milligram daily for 14 days along with the chloroquine, or because the patient come with the symptoms, we treat the patient acute condition, the fever is subsided, and if he complains, or we can give that, okay, you use this Primaquine for the 14 days so that there will be there will not be any next episode of the malaria. So for radical cure, remember the one drug Primaquine, and it affect again the all species, and this is the main drug. Adverse drug reaction of this drug is that it make us methemoglobinemia. Okay, the important thing about is that this drug you have to take care when you are given in the patient who has 6 dehydrogenase deficiency. Okay, I am not remembering the whole name of this enzyme, but this enzyme is basically present in the red blood cells of the some people, especially in the African people. And in these people, if this drug is given, it may cause this methemoglobinemia. So this is have to take care. The black people, this is especially for the America and other countries where you find out the two variants of the white people or the black people. They usually have this enzyme deficiency, glucose 6 phosphate. Sorry, yes, I remember glucose 6 phosphate dehydrogenase deficiency. So this enzyme is deficient in some people in the community, and in these people it causes a reaction is known as methemoglobinemia. So this is side effect we remember. Okay, so this is, so far we have discussing the classical drugs for the malaria that are basically quinolines group. Discuss chloroquine, quinine, mefloquine. Now we have a new group of the in the history that is basically effective against malaria. This is known as artemisinin. So this drug is coming for have come from the last 5 to 10 years, and artemisinin is a Chinese herb derived from a plant, and this is effective in the malaria. The chemical compound of this is a terpene. Terpene is a class of chemicals, long chain of ethylene group is known as terpene. Okay, this is chemically a terpene and derived from a natural from the plant. It has two forms. One is aqueous form, one is lipid form. Artemether is a lipid form. Artesunate is an aqueous form. Lipid form is more common, and this is usually given. Okay, this is a rapidly acting blood schizontoside. So this drug is nowadays very much using in patient because it has not shown resistance. Previously, chloroquine was used, but now this chloroquine is replaced by this artemisinin group. Okay, no known resistance yet. Now means we are still safe using this drug because, but maybe with the time, if we use this frequently without The diagnosis, if you use it abruptly, it may also cause a resistance in the future. Mechanism wise, it is different. It does not affect on heme or other process. It affects onto the uh, in the liver. It is converted into dihydro. This is the active compound. When it taken to the patient, it is converted into this form. The main action of this drug that it damages the parasite membrane by free radicals. So it generates a free radical, and these free radicals basically damage directly to the uh, membrane of the parasites. So the mechanism is not indirect like the chloroquine, which basically affect on heme and then it kills the bacteria. This effect directly it produces free radical, and that free radical damage the membrane of the parasite. Once cell membrane is damaged, the parasite or organisms usually die off. So free radical generation, and it damages the parasite membrane. It has to convert into the liver with dihydroartemisinin. Absorption is good. Uh, Kinetics is easy. It can be taken as orally and can be easily absorbed. Pharmacokinetics half-life is 4 hour. This is the aqueous form. The half-life is low, 45 minutes. Artemether is the lipid form. It has a long half-life. So usually this form artemether is used. Adverse effects. The symptoms are mild, heart, neutrophil, decreased neutrophil count, neurotoxic in animal. So not very much known adverse effects. So resistance is not there. Adverse effect is low. This is why this drug is nowadays a top priority to treat the malaria patient. Another group we use is atovaquone. This is also a drug which is used as for the blood and tissue oncocytes, and this drug is effective in the resistance cases. It has also mechanism similar with the chloroquine, again the electron transport chain, but okay, but no, this effect on electron transport chain of the parasite, so respiratory chain it affects, and this drug is also effective as a blood and tissue oncocyte. a, a new combination Malaron is nowadays given, which is a combination of this atovaquone and proguanil. So this is also a drug that is used nowadays in the case of blood and tissue oncocytes. Nowadays, the combination that we are using is the artemisinin group and another group known as halofentrine or lumifentrine. So this is a very well-known combination nowadays. What is halofentrine? First we discuss, and then we will discuss the combination. Halofentrine or lumifentrine are the drugs that also blood schizonticides. They affect on resistance cases of the chloroquine, and they are combined with the artemether, and this combination is known as coartem. So coartem is a very good combination nowadays. This drug is very well known. When you combine the artemether drug with the lumifentrine, and this is a classical combination known as coartem. So this drug is effective. Specific mechanism we didn't discuss. So up till now, the good thing about malaria or for the treatment is that we combine this artemisinin group with this halofentrine or lumifentrine, and this is a combination which is very effective. Synergistic effects are also seen. So this we usually give in the malaria. Antifoliar drugs, they were of previous concern. Previously we used these drugs, but nowadays they are not very much in the clinical in the market, but we use discuss these drugs. Antifoliar drugs, we know we have pyrimethamine and sulfonamides, and you know that they have a different mechanism. Both of them, they basically inhibit the folate formation, and once folate is not formed, RBC will not mature and the RBC will rupture. Since the primary site of the bacteria is RBC, so you destroy the RBC, and this is how this parasite kills. It does not remain in the red blood cells, and usually its proliferation is stopped. Uh, Sulfonamides is again effective in falciparum phase, resistance cases. Proguanil is also another form. We also discuss some antibiotics as well, in some cases like doxycycline, clindamycin, and they are also of specific use. They are used in a specific condition. Okay, so if we summarize in the end, what is the standard care of treatment nowadays, or we give with the WHO guidelines? The best combination that is also approved is the artemisinin combination. Artemisinin, artemether you use, and then you combine is with, you can also combine with mefloquine. Artemisinin can be combined with lumefantrine. This is known as coartem. Artemisinin can be also combined with amidoquinine. So in all this combination, the artemisinin or artemether is the main compound, and you can combine with different. This second combination, lumefantrine, this is very much common in Asian countries as well. This is given in South Asian, but we also use this coartem very frequently. Also, in the case of falciparum resistance cases, you can use IV artemether, and also, this is the aqueous form. So in case of resistant cases, previously we used quinine, but we discussed that quinine have a very strong or fatal side effect, like that is black water fever. So nowadays quinine has been replaced with the IV form of the artemether. The last thing we discussed is prophylaxis. Whenever you travel to a area which is endemic to this malaria, we usually give chloroquine, or mefloquine is also is a drug that is given. So for prophylaxis, you remember the drug mefloquine. For radical cure, you remember the primaquine. These are the two drugs. Otherwise, all drugs discussed as a main drug for the treatment of malaria. So prophylaxis, radical cure, you remember the two drugs mefloquine and primaquine. This is the summary, whatever I discussed, that it's just a little stats that 90% of malaria in cases of death, in still malaria is a very fatal disease in the Saharan or African condition. And again, this happened with the resistance cases. Resistance cases are the main reason for this. Artemisinin have given a very good response, and it has actually decreased this resistance from now, and it has cured the malaria within 7 days. So this is a good drug. I just give you a 2 or 3 lines summary. Otherwise, these two slides are good to remember for standard care of treatment and for the prophylaxis. Okay, now the session is open for any discussion. You can ask questions.